I have with me Ontario Veterinary College researcher Dr. Luiza Arroyo and Dr. Luiza Zakia, and today we're going to be discussing colitis. First of all, Dr. Arroyo, how would you define equine colitis?
Yes, by definition, equine colitis basically means inflammation of the colon. Now, in horses, because they also have a very large cecum, technically speaking, it should be called typhlocollitis, but for short, we only call it colitis. Now, that is a very scientific description and based on histological analysis, but the hallmark clinical sign of colitis is diarrhea, which is usually what we see clinically. Having said that, not all horses with colitis will necessarily develop diarrhea, and not all horses that may have diarrhea will necessarily have colitis. For example, a horse that is being given a lot of oral fluids, for example, for impaction, may develop a transient diarrhea episodes, but they do not necessarily are suffering from colitis. And that would be, what we are working on to work on a more standardized and precise definition.
Can you elaborate on the current challenges and gaps in understanding on acute colitis in horses?
Well, the problem with colitis in horses is that it's very complex and can be affected by several factors. It can be caused by something that is from infectious origin, like bacteria or virus, or non-infectious, like a toxin, for example. So there are challenges on understanding the disease from, the multifactorial nature and the many possibilities in terms of causes as well as risk factors. Risk factors, for example, being the use of antimicrobials, prolonged transportation, stress of some sort, all those other things, even diet or changes in diet, things that can potentially have an incidence on the disease. So, and there is a lot of lack of knowledge on the current understanding of clear definition of the disease. So there are no clearly defined criteria to categorize acute colitis, which make the diagnosis challenging and precludes research studies from being comparable. So the lack of clear definition of the disease is by far one of the major gaps on understanding equine colitis in horses.
Who are the collaborators involved in this new study coming out on developing a core outcome set, and what roles will they play?
That's the most exciting part. So Luiza, Dr. Zakia is one of our newly recruited faculty at OVC in clinical studies. So Luiza is my direct collaborator or co-investigator, and we are working this together. Luiza comes with experience and knowledge about how to work in this research based on some studies she's conducted in calves. So we are working together on this project, and we have just recently hired a new grad student, and she will probably be part of this study, and she will be conducting the bulk of the study. And plan is to start as soon as possible.
Dr. Zakia, can you explain the process of developing a core outcome set for this project?
Yeah, absolutely. So to get started, a core outcome set is the definition of the disease and the clinical signs or, laboratory analysis, ultrasound, everything that we need to check and report as a minimum to say this horse has this disease or not. So this actually comes from the human medicine world because it seems very simple. We don't have a clear definition for this disease, but it actually happens a lot with multiple diseases. And then what happens is we have our study, your study, but then at the end, we cannot compare them, we cannot combine them. So we just have my evidence, your evidence. So the goal is to have something unified that in a few years, we have all the studies saying this is what colitis is. And so the studies can be comparable. And then we have a more solid body of evidence, and then we can improve how we're diagnosing and treating the disease. So that is what core outcome set really is. So to do that is not just my idea and your idea. We have to follow a protocol. So there's very strict guidelines on how we should do that. So we usually start by doing a scoping review. So we look in the literature, everything that has been published on acute colitis in horses, and we create a list of what people have used to define acute colitis. So probably diarrhea is going to be on top of the list, or fever, or decreased white blood cell count. So we see what other researchers have used to define acute colitis in horses. Then we move to the second part of the research. So from this group of researchers that published papers on acute colitis in horses, we're going to get the highly publishing authors. So usually people that have published more than 20 papers in the past 10 years on this research. And we interviewed them and we're like, what do you think we should really be measuring when reporting on acute colitis, and how to diagnose acute colitis? Then we get their ideas plus everything that has been published, and we do a 2-round Delphi survey. So we create a Qualtrics survey, a regular survey, and we distribute to veterinarian practitioners, ACVIM diplomats, and that's not just in Canada or North America, it's across the globe. And then people are going to vote. Yes, I think we should say if the horse has diarrhea or not, or like, oh, I don't think, the ultrasound changes are relevant. So we'll do that survey twice, and we'll have everything ranked, like people that research colitis and people that diagnose colitis, so practitioners, they will be voting on what they think is relevant. And then at the very end, we're going to get that research group that we interviewed initially together, and we're going to have a consensus meeting, because we have criteria. So if if like more than 80% of the people said one criteria should be included, that criteria is automatically included. And same, if everybody votes, oh, we shouldn't be measuring this, then that doesn't get included. But we always have the gray zones. So we have very strict criteria on how we're going to decide if we're going to include or not. And we'll have this final consensus meeting just to make sure we're all on the same page. And that is what we're going to say is, if you're doing research on acute colitis, you should report at least these criteria. So in the future, we can combine these studies and do a synthesis analysis.
And how do you envision the development of a core outcome set impacting the equine industry and veterinary practices?
Yeah, so I think the first direct thing is that we're going to have a more standardized way to say this horse has colitis or this horse does not have colitis. Veterinarians that are out there, they can, use this criteria and be like, yes, I think this horse has colitis. We can treat this horse this way, or, we should refer to a hospital. So we're going to have at least a diagnosis, which now we're just like, oh, this horse has diarrhea, or we think this horse has colitis. So we're going to, have a more standardized way to talk amongst ourselves. And then if we have a more standardized way to define colitis, all the research that we do from now on will use this criteria, and will be, we'll build a more solid evidence. So we'll progress quicker into understanding, because as Dr. Arroyo mentioned, there's so many factors that causes colitis, and we know some pathogens that are linked to it, but I think there's a lot more. And because the research that we do, everybody kind of defines colitis differently. We can't really compare anything. So by having a more unified definition will really advance the research, and then long term that will lead to maybe a better diagnostic protocol and better treatments for the horses. So immediately we'll be able to communicate better amongst ourselves, diagnose the horses, and hopefully with the research we'll have long term we'll gain more knowledge by just doing things more standardized.
What can horse owners do now, Dr. Arroyo, to reduce the chances of their horses developing colitis?
In order to reduce the risk of colitis, I think owners should still focus on maintaining a well-balanced diet and avoid sudden changes that can really disrupt the gastrointestinal system, the microbiome, the microbiota, and that can lead to dysbiosis, and that can lead to, basically an unhealthy gut. And so, as I mentioned earlier, we know some stressors, and from the human literature, we know, for example, that antibiotics, doesn't matter how friendly they are, they're always going to be a risk of developing diarrhea due to disruption of the microbiota. So if you have to use it, but sort of like judicious use of antibiotics is very important. If a horse is going to go under a stress situation, let's say prolonged transportation, well, maybe adding a couple of stops, to let him rest, to let him go for a walk, to let him drink some fresh water, to let it graze for an hour or something like that. That might minimize a little bit the stress of the whole trip, not only for the gut, but also for the lungs sometimes, for example. So those are things that can be easily added to stressful situations. Um, and then in the future, I think that we're going to have more information about, let's say, um, whether there is something that we can add before transportation, something like evidence-based. Really, there's a probiotic that we can really add to it, something like that, or vaccination, for example. Does the vaccine for Potomac horse fever is going to be effective on preventing disease? So we will have more data to say, yes, we definitely recommend to vaccinate at this time of the year to reduce or minimize the risk of developing disease. So I think that little by little we'll be adding more information to the current knowledge of colitis. And we are in a really good time because, for example, Guelph University or OVC has been the leader on organizing colitis international meetings to increase our knowledge. So we just had last year the second Habermas workshop in equine colitis in the United States, and we just been approved the funding to do a third meeting in 2028. So probably Luiza and I will be leading this meeting, or we will be, bringing researchers and clinicians and equine colitis experts, I hope, from around the world, and work exactly what Luiza was explaining, developing these core outcome sets and defining these things that is still rather obscure, and adding more evidence to the knowledge that we have, and hopefully stimulating international studies to have larger data sets. And in that way, we will be able to really provide some good recommendations to the owners about how to prevent, how to recognize early disease, when to refer, and how to treat them.
Oh, thank you. Thanks for the helpful tips, and we look forward to following the upcoming research.